cover it up with conjunctiva, put a running suture in it, a continuous suture, and just put one long suture in it and cover it up. It's amazing how well those that helps these animals heal. I mean, here's a lower lid, really lit. This is a bit bad. This is bad lesion because it's so big. And there's just not a whole lot of tissue to work with. So we tried, and you see the upper right. It's not a great picture, sorry, but you see the triangles are drawn. We're going to move the tumor. Lower left, we've created the Burrow's tunnel triangles to slide the skin forward, and you see with releasing sutures with some difficulty, we finally are able to slide it so we can do these surgeries. This case 6 weeks later. We got a lot of, I guess we'll call it ectropion. Tumor hasn't recurred yet. Horse is able to use its upper lid to protect its cornea, and at least at 6 weeks later, it was reasonable. Beta radiation for superficial squamous cells of the cornea and limbus. If you can refer to somewhere, it's really wonderful to be able to use radiation. It's just not available too much. Small squamous cells can be burned, or can be lasered, or can be frozen. This is a really bad one here. It looks like an orbital squamous cell. Here's an example of doing a keratectomy. This is all in the cornea, and so we're going to outline the edge of the lesion. And there's so much tumor here; it's so proliferative. It's hard to find the cornea. Eventually, I got frustrated and cut it all off, despite the bleeding, and make a in order to make the keratectomy site. Now this particular tumor is growing out, but it's not growing deep. Most of the squamous cells in the cornea are not invading the cornea deeply. I mean, they're surely going sideways. They follow the collagen lamellae sideways, but they don't grow deep into the cornea very often. So here we go. We finally got a little bit exposed. We're using the crescent blade to cut sideways. It gets kind of frustrating at this point because there's so much tumor here. You just can't see what you're doing. So at this point I've gotten a little frustrated with it, so we're just going to get rid of some of this proliferative mass so we can cut it down to the cornea and just deal with the tumor that's there. Then it becomes easier. Oh, here we've got most of it lifted up. Almost all. Now we can see the iris again. I'm back in the conjunctiva. I've dissected back. I've got the entire cornea dissected, and I'm back in the conjunctiva. And this one, where I learned over the years, we did radiation, and then we were covering it up with amnion. Radiation does weird things to the weird meaning unhealthy things to the cornea, and it can cause some pretty aggressive ulcers by itself. So we learned to not leave the ulcers bare. Don't leave the keratectomy sites bare. Cover them up with conjunctiva, or cover them up with amnion.